My name is Bilal Chughtai, and I'm a urologist at Plainview Hospital. I've been in practice for over 12 years, and I specialize in male voiding dysfunction. In my practice, I see a lot of men with voiding issues. I would say about 2/3 to 3/4 of the men that I see have BPH, and of those men, there's a fair number who also have concomitant overactive bladder. There's probably a cohort of about 20-25% of men in my practice who predominantly have overactive bladder. Most of them are referrals from primary care, and when they do come in, they typically don't have a diagnosis of OAB. They sometimes will have a diagnosis of urinary urgency and urinary frequency, but almost all of these men will have a diagnosis of BPH. Symptoms of BPH and OAB overlap quite a bit, but I usually look at the symptoms of urinary urgency and frequency as pertaining to overactive bladder, versus hesitancy, straining, and restream are more associated with BPH. I do use a fair amount of bladder diaries, and with diagnostic uncertainty, I will utilize urodynamics to help differentiate these two conditions. For men with BPH, I typically like to start patients on dietary modifications or behavioral and lifestyle changes. After that, I generally follow the AUA guidelines. For overactive bladder, I tend to see that a lot of these men are treated like they have BPH. Some of these men do have BPH, but they may also have concomitant overactive bladder. In my practice, I try to differentiate men who have more bothersome storage-related symptoms like urgency and frequency, and I typically prescribe a beta-3 agonist. In fact, Gemtesa received an expanded indication for the treatment of OAB with symptoms of urge urinary incontinence, urgency, urinary frequency in adult males on pharmacological therapy for BPH. I would say with OAB, we're dealing with a preference-sensitive condition, so treatment is really up to the patient. When patients come in, we first focus on understanding the disease process. We then focus on how we can make the patient feel better, and this almost always involves a discussion about medication options. With medication, I focus on efficacy and side effects. I also align with the patient to understand their goals and concerns in order to determine the best course of treatment. So, depending on their preference and their underlying condition, that will dictate a lot of what I do. I consider Gemtesa for any patient with symptoms of OAB, urgency, frequency, urge urinary incontinence. I found it helpful for patients with cardiovascular risk factors because of its known safety profile. Note, in a 24-week study of OAB in men being treated for BPH, rates of hypertension were 9% with Gemtesa versus 8.3% with placebo. I'll also often use it in men with OAB symptoms who are already on treatment for BPH. The most common adverse reactions, greater than or equal to 2%, reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Overall, it's a simple, once-daily medication with proven efficacy and is generally well tolerated.
Indications and usage. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. Gemtesa is contraindicated in patients with known hypersensitivity to Vibegron or any components of Gemtesa. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. Angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see accompanying full prescribing information.